Okay. Good morning, everyone, and thanks for those who are watching in the public. So welcome to our staff meeting for this week of, this is our July 1st week. July 1st would be Wednesday, the meeting day. So this is June 30th. So welcome to staff meeting and those watching. So
Good morning.
Tom Stoltz, good morning.
Good morning, Chairman and Commission. Two items for the staff meeting this morning. One, we had an opportunity about a year and a half or so ago to have discussion with Evergy regarding acquiring electrical power through a wind grid for the county. At the time we had the discussion, there was no openings available for companies or businesses or governments to acquire that type of energy. And we told them to keep us in queue in case the opportunity ever arose again, and it has done so. So Andrew Diltz will be here later to talk us through that agreement, if the commission wants to move forward with it, and some of the ins and outs of that. So that's the second item. The first item will be the COVID update, and there's been a lot of action with COVID lately. Adrian will talk us through the dashboard as it sits today. Dr. Minz is on hand to maybe give his opinion of what the numbers are doing. And then Tim will conclude that discussion with some testing update. And there's been a lot of action with testing too. So we'll get you all updated on COVID and go from there. So with that.
Okay, thank you.
Adrian, you start us off.
Hello, Adrian, good morning.
Commissioners and Board of Health, Adrian Burns, Sedgwick County Health Director. So currently Kansas has 14,443 cases of COVID-19, and Sedgwick County has a total of 1,161 cases as of yesterday. A total of 649 people have recovered from COVID-19 and 28 people have died. So I wanted to let people know and remind everyone that on our Sedgwick County website, we do have a map of other locations where testing is occurring. And when you go into that map, this isn't really showing us the way that it will on your computer, but if you hover over it, it will show you that Health Corps, Grace Med, there's a Via Christi Ascension Clinic on Murdoch, and a couple other areas that do, a couple other locations that do provide COVID testing that are not just for their patients, because there are a lot of other locations and physicians that are providing COVID testing as well, but they are just for their patients. And on this website that I'm not, or this page I'm not able to really show that well, if you type in your address, it will let you know where the closest location is to you. And then on our dashboard, there's a lot of information on our dashboard, and it can be difficult to find. The testing information that I wanted to specifically point out, if you click on the tab on the bottom that says demographics, it will pull up three tabs, and the two that I wanted to focus on were our Sedgwick County testing, that as of yesterday, approximately 5,300 people have been tested through Sedgwick County Health Department. And then we have the numbers of people that have been tested by race, and then also the rate by race. And so when you look at rates, you're able to compare apples to apples in regards to population size. And so the COVID health testing rate by race shows that with whites, 749.4 out of every 100,000 whites are being tested, and 798 out of every 100,000 blacks are being tested. And then other, some people leave it blank or wish not to report on that. And then there's an age breakdown, and then also by gender. And then going to all testing, we're able to see that in Sedgwick County altogether, we have approximately 29,000 people who have been tested at one location or another. And the other is always interesting to me. I think that there's sometimes not all of the data must be getting obtained, because that's a lot of others. So I'm happy to say that we don't have quite that many at the health department. So this is just, there's again, a lot of information crammed into our dashboard, but that is the testing that I wanted to share this morning. And then the other piece that we have added, and we're working on another dashboard that's going to be able to have more, explanation as to what these charts and graphs mean, because they can be confusing and difficult to make sense of. And so we are working on that, because this platform doesn't allow us to go in and have explanations. So the other thing that we have added is our recovery matrix. And this is what we look at, and particularly Dr. Menz, we share with Dr. Menz to help make decisions about his opinion on what we should do as a health officer, and also are sharing this with our Board of Health. And so you can see that the three main metrics that the state of Kansas and we and a lot of other states are following is that the main three things being tracked are new deaths, new COVID hospital admissions, and then cases per 100,000 residents. And then we break it down beneath that to look at all new cases, and then cases that don't have clusters as part of that number, because then that gives us more of a idea of just how much it's in our community. And then new tests per 100,000 residents. So you can see that the trend is increasing in all of the areas, not new deaths, thankfully, and our hospital admissions are still somewhat stable. But we have a lot of cases occurring in Sedgwick County, new cases, and that is quite concerning. And with that, unless you have any questions, I will step aside and Dr. Menz will share his thoughts about that.
Adrian, thank you. The dashboard is really evolving into quite a snapshot for the public. There's a lot of assumptions out there, and this dashboard hopefully is as accurate as we have at the time. And,
It is.
So I appreciate it, and we need to keep encouraging the public to visit that. It has a lot of questions, a little tough to navigate around. I can sympathize with that, but there's a lot of information.
Yes, there is. There is.
Okay.
Thank you.
Thank you. Any other questions? So far, not. Thank you. Good morning, Dr. Menz.
Good morning. Gerald Menz, Sedgwick County Medical Officer. Thank you for the opportunity to talk with you this morning.
You bet.
I so much look forward to, hopefully in a year, to be able to come over here and talk about something other than COVID. I would like to come over in a year and talk to you about how successful we are in treating tuberculosis in this county. But I'll wait for that in a year. If we review what we had attempted to do in March was to try to get control of this virus and make sure that our hospitals were not being overwhelmed, and that we could keep the incidence of this disease as low as possible in our county. We instituted a number of activities, restrictions to try to do that. In many respects, they were successful, but we sustained a fair amount of economic injury as a result of all those restrictions. So finally, by the end of April and March, we all throughout the state started a reopening process in which we were lifting many of those restrictions, hoping that the virus is suppressed enough now that it wouldn't revive itself. We've learned through the end of May, our figures look pretty good. Our hospital admissions were fairly low. Hospitals felt fairly comfortable about it. Our numbers were fairly stable day to day on the number of cases that were coming up, and it was fairly manageable. So additional restrictions were lifted. The weather was getting warmer. We had the first major holiday of the summer. We have a number of protests occur throughout the city as well as other cities. And now, the end of June, we have seen that the numbers are back up. They're not as high as they were at their high earlier in the year, but they are significantly up. We had an interval there about 3 weeks where the numbers were stable and fairly low. And now they're, for the last week and a half to 10 days, they've been going up daily, and we've had a number of cases over the weekend. I've received a call from at least one of the hospitals concerned about how their numbers were expanding, and we're nervous about if they continue to expand, what the implications would be on the hospital's ability to handle the number of patients coming in. They weren't at the crisis level yet, but they were worried about the inflection of the curve and the direction of the curve. It was just want to discuss with me what our plan was to make sure we could get that thing back under control. So what I would like to discuss with you this morning are some suggestions on how we could do that without causing any more economic injury than is necessary, and to keep that at a minimum. So we're in a balance between restrictions that decrease the passage of the virus from person to person, and yet optimize the economy so we don't have that causing additional problems in our community. Since we know the virus is primarily transmitted from person to person, people's behavior is the main thing that is controlling the transmission and the numbers in the county. I'm not trying to be cute here, but the virus doesn't have wings. The virus doesn't have feet. It requires people meeting close enough and passing respiratory particles to one person or the other that then affects them. And unfortunately, this virus has a much higher success rate of jumping from one person to the other than many of the other viruses, including influenza. And there are occasionally people we call super spreaders that for some reason, they really infect a lot of people, much more than other people do. So what can we do to try to bring this virus back under control? What can we do from the population's view? What can we suggest to the population that should be done to get the numbers back in control? So I'm suggesting this morning that we consider 3 things. I had told you at our last meeting that one of the things that we could do to control this virus is limit travel. Travel is difficult to limit. That would affect the economy. But there is one form of travel I would like to suggest that you consider, is restricting large groups of people coming in from out of state for various tournaments, competitions, mainly sports activities, because those people are coming from all over the United States. As you know, many states are hotspots now. We have no way of screening those people. I think for the time being, it would be best if we just suspended all those type of visits here to Kansas, to Wichita. I'm talking about out-of-state visits. Second thing, I think that we should revisit the idea of restricting, particularly the restaurants, but other retail venues to 50% of capacity in their building at one time. As I might remind people, we had a meeting with the various business entities in the county quite a while ago, and actually those representing the restaurant industry are the ones who came in and suggested that their restaurant industry recommendations were, until this virus was brought under control, to limiting occupancy to 50% of the fire code capacity. I would suggest, based on the fact that that was their suggestion, that we consider that and making that an order. Lastly, everyone knows the issue of masks are controversial. When this epidemic started, there was mixed messages from our national authorities about the utility of masks. I think they now regret that they allowed such equivocation about that. Wearing a mask are not 100% effective in preventing transmission, but they do have effectiveness. It's hard. There's no data yet that I can tell you what the effectiveness is, whether it's 50%, 25%, but it does reduce transmission from person to person. Because we have so many fewer tools to prevent transmission, and it shouldn't have any significant economic impact to either mandate or at least highly encourage the public to wear masks when they're outside their homes universally. I know that it was released yesterday. The governor plans to release an order to do that. I suppose at this time that's sufficient to wait to see how that plays out. If on the other hand, something happens in the future where the governor's order is rescinded or is not standing any longer and we're still having the number of problems we're having, I would suggest we at least consider that from a county order. So the virus is back up in numbers. Our healthcare professionals are worried about the direction of that. They are asking what we're going to consider doing or doing to try and get the numbers back under control without doing any significant harm to the economy. So that's my observations and my suggestion today. If you have any questions, I'd be happy to try and answer them.
Okay. Thank you, Dr. Cruz. Commissioner Cruz.
Thank you, Chairman. Thank you, Dr. Mintz, for being here today and for giving us your recommendations. I just have a quick question I have a couple questions. What are the dates in which you're going to suggest that these restrictions be in place? Like, how long should we?
That's a good question, and I meant to touch on that. I think many of us, and I can understand why, thought when the reopening plan was issued, the governor's reopening plan, our reopening plan, that we would soon, this summer, come to what we would call the green phase or the open phase, in which the restrictions would be very minimal. Based on what I've seen this last month, I'm not sure we're ever going to get to that phase. I think we're going to have to live with this virus for the next number of months until we have something better in the way of treatment or vaccination or something. I don't see this virus going away. I guess I would say at this point, I would suggest maybe a month at the least and see where we're at with the numbers. I think the numbers, we should let the numbers guide us, but I don't think we're ever going to see the time when these numbers go to zero. And we're going to have to continue some of these behaviors indefinitely until we have a better way of controlling the virus through medical innovation or whatever. So I don't think by September it's going to be zero, and I think we're going to have to be doing some continued societal behavioral activities, whether it's mask, whether it's 6-foot distancing, whether it's 50% capacity. I think that may have to become the norm until this thing is under control. Because we've seen what happens when we relax them. Mm-hmm. It's still out there. Most of us are not immune. It comes right back.
Yeah, so you're talking maybe revisiting a phased approach and starting with 4 weeks of these recommendations, reevaluating at the end of July.
Yes.
And so, okay. The next thing I'd like for you to kind of touch on is, I know all commissioners have received many emails, many articles, pieces of literature about masks and their effectiveness, some of the things that might cause harm when wearing masks. I'd just really like for you to touch on again, and you did touch on this a few weeks ago, but I'd really like to hear your professional recommendation and explanation to the adverse side of the argument for masks, as far as CO2 and carbon dioxide, all that kind of.
I'm not aware of any data that there's any proven ill effects from wearing masks. I certainly could understand where some people have a feeling of claustrophobia with them, and I understand some individuals it may be mentally distressing to wear them. However, in terms of any legitimate ill health effects from them, I don't know of any. I would point out a couple observations. Surgeons have been operating hours and hours on a day with mask on. Some surgeons operate 12 hours a day. And I've never heard a surgeon who had to quit surgery because the mask were so bothering them physically so much that they couldn't operate any longer. I will tell you our healthcare personnel who are taking care of the COVID patients in the ICUs are wearing the N95s all day long. And those masks are much more restrictive than the mask I kind of came in terms of the effort it takes to breathe and whatever. And I would say I could see where a number of people, if they had to wear an N95 all day, would find that difficult. But we're not suggesting that. We're suggesting the surgical mask or even the cloth mask would be pretty easy to wear. I think most of the ill effects are maybe the perception rather than any harm to the body. I've not seen any data suggesting that the CO2 levels are higher if you wear a mask.
The other thing I'd like for you to touch on is when someone should wear a mask. There were some comments. I mean, there's been lots of discussion around this, and I think people, I mean, when you're outside, obviously you don't really need to wear it unless you're around in close contact with people. I'd like for you to touch on that.
I think the official recommendation is to wear a mask if you're going to be in an environment where you can't maintain the 6-foot separation, inside in particular. But even outside, if you're going to sit around a picnic table with 7 other people, friends and family, you probably ought to be wearing a mask, although you'd have to take it off when you're eating a little bit. So maybe you could find 2 or 3 picnic tables.
Yeah.
I didn't want to appear hypocritical, so I took the mask off, but I think I'm 6 foot away from everybody, so I don't object to that at all. But obviously, if you're going to be in a confined space, inside, or even outside where you're going to be very close, less than 6 feet from people other than your family, I think you should be wearing a mask.
So you're not suggesting masks in the term of once you leave your house, you put it on, you don't take it off all day long. You're not suggesting that.
No, I usually drive around as the only person in my car, which I know is not very environmentally friendly, but I take my mask off when I'm in the car, and sometimes I have to bang myself and walk back to my car because I forgot to put it back on. But when I'm at home, I don't wear it. In my office, if I'm the only one in the office, and I can tell you that at our medical school, the policy is if you're the only one in your office, it's fine to leave your mask on. However, if you're going to have people come in and have a conference in your office and you can't maintain the 6 foot, you probably ought to put it back on. Does that answer your question?
Yeah. I just think that we need to offer some clarification as to what wearing a mask actually means and what the recommendations are for wearing a mask, and make sure that we communicate that should this recommendation be followed by this commission. I appreciate you being here today.
And the other thing I'm going to add about the mask, if you wear a cloth mask, you probably ought to wash it pretty frequently, maybe have a different one for every day. And our suggestion is at the schools, every day we put on a fresh surgical mask, and we don't wear it 5 days in a row or whatever.
Thank you.
Other questions?
I don't see any other questions right now. I've got a couple myself. Oh, Mr. Howell, or Commissioner Howell.
Yeah, thank you. I just have just a couple short ones. Do you know what the hospitalization rate is today? Every time you've come here, you've been able to tell us that number, so hoping you can today.
Let's see. Adrian, I think, did you have that? I don't have it today. I did not call them yesterday or today, and I obviously didn't call them over the weekend.
Okay. I would hope that you'll help us get that number. I'd appreciate hearing that. That's very helpful.
I know the numbers are up,
Okay,
but I can't give you an exact number.
very good. I don't know if the other people have other questions. I have other questions, but I'd like to just sit back and listen for a while. Thank you.
Good. I don't see others, so I'll ask a couple questions, Doctor. Regarding the large groups, the sports activity thing, the category number 1, limit, travel limit. So, I mean, some of this is going to have to clearly be, if we do this,
I understand.
defined further. So,
Yeah.
Are you okay with Sedgwick County youth getting together to have tournaments? You
And what I
just
said
don't-
was out of state.
out of state.
So if people from
Okay.
Colorado are coming, people from Texas or Arizona, which as you know are hotspots now, that to me is just, some small percentage of those groups are going to be positive and they're going to be
Right.
in town. No, I think still statewide activities.
Okay. Because I just wanted to maybe point out that the MAYB tournament last weekend got a lot of criticism. Again, there was a lot of false information out there. They were playing in 12 venues. There were also venues that were in two other counties, Reno and Harvey County were part of the venue. And even our YMCA was one of the venues. So, and these people were spread out, and I think their best guess of the large venues, at any one time, there might have been between teams and parents, maybe as much as 150, 200 people in a building. So the rumor was there was thousands of people gathered, and the reality was it was so. If we banned those here in Sedgwick County, well, Reno County right next door, and Harvey County, and of course Andover has a fantastic YMCA, so that we don't have control over. So I just thought it was a little unfair that our kids got penalized and for, I mean, verbally criticized for something, an event. But so I'm glad you're clarifying that your recommendation is out of state participants, which. The second thing I wanted to ask was about, related to the restaurant 50% capacity. And do you mean retail shops too, or just mainly restaurants where they're in there for a while?
Well, it was originally brought up as applying to restaurants
Right.
by our business community that came in. I hadn't really, I think that's something for discussion, whether it should be non-restaurant, non-eating establishments. I would prefer, if maybe as a compromise, that the non-restaurant retail establishments be pretty strict about requiring masks to come into their store.
Right.
I think that would be acceptable.
Because the retail has people moving and you're not in for half hour or an hour or something like that.
And it
Usually.
applies to the restaurants mainly because you can't wear a mask when you're in a restaurant. If you're wearing a mask, you might as well not be there because you can't eat with a mask on. But for a
point.
retail shop, when you're not planning to eat there,
Right.
you should be able to wear a mask while you're shopping.
And you referenced, I've been working with Commissioner Cruz and the manager. We're looking at kind of reconvening another cross-section of the businesses. Last time we had we had a cross-section of about everything. This time, because I think we're more focused, and we wanted to maybe try to reconvene real businesses, the hairdressers, the care homes, the retail, the restaurants. And I mean, the chamber and things like that are okay in a way, but they're not the real applicants, the banks and all of that stuff, and try to reconvene with them. If the governor's coming out Thursday morning, hopefully with her written, because there's nothing written as of yet. And so maybe we would hope that we could reconvene this group Thursday afternoon. I'm just letting the other commissioners know. Don't know how many we can get on a Zoom call, but if you would be available when we put this more defined, we can really kind of get opinion from them. If the restaurants still feel that strongly about 50% capacity, if they can all weigh in on their thought about masks in their lobbies or in their places, I think it'd be valuable for all of us to listen to their thoughts.
I think that's a good idea. I was very impressed when we met with the businesses before. That many of them said, we don't want our staff getting this virus, and we don't want our patrons getting it. That's not good for our business. So I was impressed that they had their own suggestions
Right.
on how they could control that.
Right.
So I certainly think we should listen to them. They know their business better than I do.
Yes, and it is, I wish I had the date when we had it, but it was, I don't have it, but it's been a while, right? 6 weeks at least since we've done that, so. And that's really, was my two thoughts and comments, and so, Commissioner Cruz.
Thank you. I forgot to ask, so when you talk about the 50% capacity, you're not talking about gathering size. You're just talking about what the fire code is, dropping it to 50% for restaurants. So just for clarification, you're not suggesting any sort of gathering size limit.
Well, I think I was talking about the maximum number of people they ought to have in the building at one time. They also need to address tables and how far they should need to be apart. And those kind of restrictions, I can't recite what those all were in the initial order, but.
Yeah, I went to, I took my daughter to Kobe's the other day, and they were doing fantastic. Every single person in the restaurant, every single person who worked there had a mask on. A lot of the patrons actually had masks on too. So as they were done eating, they put their mask on and left. So I was really encouraged to see, and they had plexiglass, and they cut their limits down per table. So that was I was very impressed by that. So there are people in this community who are already doing it, and I'd like to see a list if there isn't one already. I think there might be one floating around of, those people who are really doing all of these requirements or recommendations, and make sure that we highlight the folks that are really taking it seriously and being safe in our community.
I agree. I've been to a number of retail outlets where I thought they were doing an excellent job coming up with ideas on their own to prevent this infection.
Okay. Commissioner O'Donnell?
Thank you, Mr. Chair. Dr. Menz, thanks for being here as always. You're the consummate professional. We appreciate your candor. So, question today would be, what should we tell people at churches? Should they wear the mask the whole time when they're sitting in the pews? People that are elderly, people that are frail. What about individuals who have children with developmental disabilities that don't like wearing a mask? Are you telling them they should stay at home, they shouldn't go out in public, or they should force their child to do it? What about people that do have oxygen tanks? What about people that have COPD or other breathing issues? What do we tell those people?
Well, I've had some churches call me and ask me, and I say I think each individual is going to have to assess their risk and their comfort. If they're elderly, they have a lot of conditions. I know a lot of churches are not only having in-person services, but they're also broadcasting. And I've told some of my acquaintances that are elderly and have pre-existing conditions, if they see them on oxygen, it might be best at this time just to watch it rather than attend them personally. But it's up to them. If they do attend, I would suggest they try to seat somewhere where they're 6 feet away. If they can't do that, they probably ought to wear a mask. If they can't wear a mask, then...
So if they're sitting further than 6 feet away at church, you would be recommending they can take the mask off?
Yeah, just like here. If we're 6 foot away from everybody, maybe they go up in the balcony. I think at some point we got to educate people what to do and let them make a decision. But hopefully they will make a decision based on the best evidence we have.
Sure. What about, I had a constituent just message me a few minutes ago. She said that her child has developmental disabilities. And she can wear a mask, but she was saying that her son, keeping that on him would be quite the challenge. What about a situation
I would say
like
the same. Can they accommodate a place where they could sit?
Not at church. This is just in general, in public. What should she do?
Well,
because I'm sure you can imagine any child, it's going to be hard keeping a mask on, but I believe she told me that her son was 9 and has a developmental disability.
If I was counseling her, I'd say, well, if your son is with you and doesn't have a mask, he is at some jeopardy of getting this. And you need to ask yourself, is that what you want to subject your son to? Maybe you should make arrangements for him to be watched while you go shop and stay home. Because it's not just trying to protect others from him. It sounds like he would not be a good candidate. He would not tolerate this virus well. So I would highly recommend, like I said earlier, about if you got a lot of chest problems, got COPD, I would probably watch the service on TV rather than go this time, and that's what I've suggested some churches.
Yeah.
Maybe for the time being, until we get a better control of this virus, we just shouldn't take him shopping.
What are you seeing with children being hospitalized in Sedgwick County? Are you aware of any cases? What's the age of the youngest person that you're aware of that's been hospitalized?
I don't know. I have not looked at those figures for this county. I do know across the nation there have been some child deaths, not common, but there have been children who died, and there are children that are hospitalized right now somewhere in the United States, but I can't give you a number.
Sure. But anecdotally, have you heard of any child in Sedgwick County being hospitalized?
No one's told me of any case.
Right. Okay, thank you.
I admit children death and even ICU hospitalizations really relatively low, really low. But it only takes one.
Right, and generally those are children that have other underlying health conditions. Have
In
you heard of
general,
any
yes.
healthy child that's died from
I would
this?
have to review.
I'd be interested before you come back
Yeah.
to answer these questions for me. What's the youngest person in Sedgwick County that's been hospitalized? What's the youngest person who has passed away? was anybody 100% healthy with no underlying health condition? Those are questions that I would love to have answered so that we can make informed decisions.
And the other piece, though, is children indeed don't seem to get as sick with this virus, which probably translate that they're more likely to be asymptomatic carriers or low symptom carriers.
Sure.
So on the other hand, if the child's in the retail place with no mask, elderly people could be there. If the child has a cold from something else, is sneezing, whatever, they could be a transmitter too.
Oh, which is very common
yeah.
for a lot of illnesses. I know with children, they are
They're very
carriers.
good. They're very good.
Yes, they're very talented at that, and they have very good immune systems generally. But
Yeah.
I would just be interested
I'll
to
see
find
what I
out
can find.
the age of the youngest person that's been hospitalized. I'd be interested in finding out the age of the youngest person who has been tested that actually has the coronavirus. I would like to see, not just for Sedgwick County, but if you have anything nationally, anything across the state of Kansas, I would also like to see if what the youngest person in the state that has died from coronavirus, but also the youngest person in Sedgwick County as well, just so that we can continue to make informed decisions. Because, Dr. Menz, I've had 2 outbreaks of nursing homes in my district, and so I've had a lot of people that have passed away, but I have not heard of anybody that was healthy and in good shape in my district, so from the people that I've talked to. So I need to be able to make informed decisions.
And we'll see what I can find out about the pediatric cases.
Thank you,
for
sir.
Sedgwick County.
Thank you.
It'll be a little bit more difficult to get state and national since but I will. I know we've had, as you know, most of our deaths in this county have been from nursing home, long-term care facility patients.
Like 80%?
Something like that.
Right.
However, I do know that some of the non-elderly patients that have been in the ICU, there's been a couple that were really bad,
Yes.
really sick, seriously ill. And even though they may have recovered and gotten out of the ICU, they're having symptoms that linger.
Sure, long-term effects. But I am interested about the
Yeah,
children
I'll see what I
because
can
that does
find out.
affect what we're talking about with youth sports, what
Sure.
the question Commissioner Meissner was asking about. So that there are just some
Yeah.
realities we need to be able to make
Yeah, I'll see
decisions
what I
on.
can
So
find out.
thank you, Dr. Menz.
Thank you. Commissioner Dennis.
Thank you, Mr. Chairman. Well, Dr. Menz, I always ask questions about testing, so I'm interested. We've been hearing about this new saliva test where that they have to come up with 5 cc's of saliva. Do you have any information on the accuracy of that type of test?
I've not seen any scientific data on it, although I have done some literature search, and studies have shown that there's quite a bit of virus in the saliva. Apparently the virus can attack the salivary glands and actually be in the salivary glands. So right now saliva is a promising place to look, and so there are now studies going on to really find out how it compares to the nasal swab. So I think it's promising. I don't know if we're quite there yet, but it's certainly something on the horizon that we need to keep track of.
Okay, but one of the reasons you told me that you didn't like the serology test as well is because of the accuracy rates. So can you tell me anything at all about the accuracy rates of the saliva test?
I was discussing that this morning with one of our epidemiologists at the health department. They were trying to do more research and find out how much study had done. They knew what the company's statement was, but I think we've learned from the antibody test we need to have an independent evaluator do those studies. And at that point, we didn't have an independent validation done. Sometimes, not being critical, but sometimes the company's data is maybe not as objective as I would like. So I'd like to see an independent agency do the validation. But we will keep on top of that.
Oh, good. Well, if you hear anything about the accuracy of those tests, I'd be very interested.
And there's some discussion going on in the city of even the current PCR we do, switching over to saliva rather than the nasopharyngeal swab, which I think some of you can testify is probably not something you want to do every day. And that saliva would be a lot more palatable, a lot more appealing to people to give a saliva sample, and a lot easier for our screeners to collect that than it is for the nasopharyngeal. So that's another promising possibility that we're looking at.
Very good. Thank you, Mr. Chairman.
Okay. Commissioner Howell, you said you might have a question because there's no others.
Yeah, I'm just, thank you, Mr. Chairman. Thank you, Dr. Mintz, for being here. I think that, Commissioner Cruz kind of ask a couple questions. I'm kind of have the same, some of the same curiosity. So your suggestion today, you said maybe a month, and some of these things may be indefinitely. Can you elaborate a little bit more clearly? What do you mean by a month? What mitigations are you suggesting for a month, and which mitigations are you suggesting for indefinitely?
I think the groups coming in from out of state probably should just be, that should be the case for at least the next 6 months. That's, and possibly beyond. The only reason I say the next 6 months is there is some hope, only hope at this point, that the first vaccines might be available. Of course, we don't have proof yet that the vaccines that are in development are effective. That hopefully by December we will know whether they're effective and if they are effective. They claim that the first vaccine will be on the market. They claim that while they're doing the testing for these vaccines, they're also ramping up production, which is very unusual in the pharmaceutical world. Usually they won't go into production phase until they've proven the test is, proven that the vaccine is effective. But because of the urgency of this situation, they're going ahead and ramping up production so that the day they say this vaccine works, they can put it on the market and start distributing it. What I've read is December would probably be the earliest the vaccines will be ready. I think we'll have to reevaluate at the end of the year. Is that hope going to come to be or not? Will they move the date out further? So I'd say at this point, at least the next 6 months, we'll have to see what things look like in late November.
I am curious, looking at the data, what specifically has you the most concerned in terms of the data that's causing, if you will, a new opinion or a stronger opinion that we should do something different? What is specifically are you looking at?
I would say the number of cases per day we're seeing were much higher than they were 3 weeks ago, even though our testing number has stayed constant. So that means there's more cases in the city and there's more people spreading it around, giving it to each other. The hospitalizations will lag, but the hospitalizations are up too, which gives me great concern.
Yeah, our dashboard, I don't think, is updated for hospitalizations right now, which is unfortunate. But what is shown on the dashboard right now doesn't really indicate that there's an increase in hospitalizations, although I do believe what you're saying is probably true.
The hospital official that called me late last week said, "What are we going to do about this? Our numbers are up significantly. I'm concerned."
Yeah. And I don't know what that threshold would be that we would want to, sound the alarm type of thing. But from the data I have been able to glean from various sources, I would calculate that we've been around 5%, maybe as high as 10% of our resources available at the hospitals. I don't know if that's fair or not, but if it's around 5%, that doesn't sound that concerning necessarily. Although it sounds like we have a lot of capacity left to go, but I don't know what the number is today. So I guess I would like to know some way to judge our capacity and try to maybe throttle our policy based around what are, something objective such as hospitalizations.
Well, just so I'm clear, his concern was we can still handle it where we're at. We don't like the trajectory of the curve. And so, Dr. Menz, tell me what we're going to do that convinces me that curve will not keep climbing.
So I'll make a couple of comments and ask you to, I guess, see what your response is. I think that Sedgwick County, for whatever reason, has been, compared to our population, has been very low in our numbers from the very beginning. And some of this, I don't know if it's considered catch up. I'm seeing that the numbers across the entire country and all around us are changing somewhat. So I don't know that, there's a lot of different governing bodies out there, a lot of different jurisdictions, a lot of different policies, and yet I don't see anybody out there necessarily has changed the trend lines necessarily significantly that I've seen connected to policy. So that's a concern of mine. But going back to my first comment, I think that Sedgwick County, for whatever reason, has had incredibly low numbers. And let me couch that with some data. We have over 1/6 of the state's population. In fact, we have about 18.5% of our state's population. And yet our cases in Sedgwick County right now are about 8% of the state's cases. And that's after all these increases that have happened. So we're still, very low numbers compared to the rest of the state. The state has 110 active clusters. And I don't know what our numbers in the Sedgwick County are. I think it's around 7 or 8 active clusters total. So there's a number of ways of looking at this. In fact, we haven't really had an explosion of clusters. That's one number that's continued to be, well, our last couple of clusters reported have been our long-term care facilities, which, by the way, have the greatest controls in place. And so if we see the population, responding with clusters around the population, I would maybe feel differently, but we haven't seen that in our numbers. So I'm just presenting that to you as, maybe what we're seeing right now is a bit of a normalization of Sedgwick County compared to other locations. Maybe more, I would use the word catch up. We're catching up, if you will, in some way, but I don't know that our numbers alone are indicating we've got a unique challenge here in Sedgwick County. Can you please comment?
Yes, I would say I agree with you. I think we're very fortunate in Sedgwick County that we've kept our numbers manageable and we've kept our hospitals from being overwhelmed. We want to keep it that way. I want to keep the numbers in this city as low as possible. Just so to answer your question, we have had 14 clusters in Sedgwick County.
I was referring to active clusters. I'm sorry.
Okay. I would say I don't want to catch up with Wyandotte County. I want Wyandotte County to catch up with us. This disease is not good. It has caused deaths that were not necessary, that would not have occurred had this disease not come. I have to tell you, as a health officer, my goal is to keep the death as low as possible and to keep the number of admissions to the hospital as low as possible. And that's why I'm saying today, these are things I would suggest that I hope could do that without hurting the economy. I realize the March and April things, there was collateral damage. And I hope the things I'm suggesting today, I hope would not, we'd like to hear from the businesses, but would not cause much disruption of the economy. Right? So I want to try and keep that balance. But I would say I hope the other counties can emulate Sedgwick County and keep their numbers very low.
Well, I do agree with you, Dr. Mins. We want to keep our numbers as low as possible, and I agree with you on that. By the way, I need to correct what I just stated a moment ago. The state has 210 clusters, 101 active clusters. That's a reduction of 5 since last week. So they've actually gone down in active clusters. In fact, they went up from 209 reported clusters to 210. So they've added 1 cluster in the last couple of days, but they've actually gone down by 5 active clusters as the state of Kansas. And so our total clusters, as you said, was 14. Of those, I believe 5 of those are long-term care facilities. 1 is corrections, which is basically not actually in Sedgwick County. It's people that Lansing Correctional Facility outside Sedgwick County. It constitutes around 50 active COVID-19 cases. We've had 5 businesses and 3 religious institutions, of which the religious institutions have completely recovered. They're not considered active at this time. I would say, I have attended church recently. I continue to. I'm a pretty faithful attender, but as I've gone to church recently, I've noticed that the population there has gotten much larger. People are going to churches that are open, and I'm surprised actually that the religious institutions haven't seen an increase in clusters. And so I don't know what's going on necessarily, but it's very interesting to watch those numbers. But again, kind of just summarizing this comment, if we only have around 7 or 8 active clusters in Sedgwick County and the state has now 101, we're very, very low, and that's a good thing. So I guess I'm just wondering right now what it is in our data that's causing us to, I guess, implement new restrictions at this time. That's my concern. I'm not saying that we shouldn't consider it at some time. I'm just wondering. Let me ask the question another way. Let's say we implement these suggestions that you've made this morning, and our numbers improve. Are we going to unrestrict them again, go back to where we are today, and we would expect the numbers to stay there? Or we would expect the numbers to return where they are today again?
I think I tried to answer that to Ms. Cruz. If these restrictions don't cause much collateral damage, much problems with the unintended consequences, I suggest that we may have to continue those until we get a better control of this virus through vaccines or medical treatments. So I'm saying I don't think we can expect everything just to kind of go back to even semi-normal before we have a better way of controlling this virus other than behavioral factors.
I guess my takeaway from that is, and I believe this is what policymakers need to understand, whatever change we make, needs to be for the long haul. I don't think we ought to be changing policy every 2 weeks. And I think that if we're going to implement some type of restrictions, it's from now until the virus is conquered with a vaccination or whatever it would be, whatever would say that this is no longer a challenge to our community. And so policymakers need to understand whatever change we make, whatever restrictions we implement are for the long haul. It shouldn't be for 2 weeks. It shouldn't be for 30 days. It's for probably a year, to be totally honest. And I think, that, again, the optimists out there would say we may have a vaccination in January, but that doesn't mean it's readily available. And again, that's optimistic. It's more than likely going to be a year from now. So that's the reality of this. What world do we want to live in for the following year? And what restrictions are we willing to implement for a full year? And if it is 50% occupancy, understand that's the new normal for the next year. It will not change. And if it's going to be mask wearing, it's for the next year. It shouldn't be just because our numbers improved for a short time, because if you undo that, if it was successful, and I'm not so sure that it will be successful, but let's say it is successful, you wouldn't want to undo that and go back to where we are today with, increasing numbers once again. So those restrictions will stay there from now for the following year. And that's what we need to understand. Whatever restrictions we allow to go forward or mandate to go forward, that they are there for quite a long time. I do have some other questions.
Can I respond?
Yes, sir. Yes, please. I'd love to hear from you, sir.
First of all, I want to give a shout out to the health department. I think the health department has done a fantastic job of getting these clusters under control and counseling some of the other long-term care facilities about the things they need to institute to keep us having more clusters. So one reason Sedgwick County is doing well, which I agree they are, is because we have been very progressive in trying to help the various agencies and respond quickly to them when they have problems. I was proposing 3 interventions. I can't tell you which of the 3 would be the most important. I don't have a way of quantitating that. I would say I agree with you. We need not just Sedgwick County, but the state of Kansas and Texas and all the other states need to do something that gets out of this yo-yo thing, or where we get the numbers down, where we're comfortable, relax, and all of a sudden, here they come again. And then we have to go back down. I think we've learned from what we were comfortable, we felt good about May, and then 1 month later, the numbers are back up, not just here, a lot of places. So I think we're all struggling out how to find that balance of what controls, I won't like to use the word controls, what suggestions we can make the community to implement to try to keep us at a static, stable level that will hold us out until we get to the day we have a definitive answer for this virus. Now, maybe after a month or so, we're willing to see if lifting the 50% leads to any change, but we have to watch it closely. We have to watch the numbers every week, every 2 weeks. And I think that's what we're saying now. We've watched a month, and the numbers are got a pretty steep increase.
Very good. Thank you. One of the things I have noticed as a commissioner, I hear from a lot of people regarding it's a bit of a frustration on the part of many people who have been tested that they don't get the results back very quickly. In fact, I know one person I'm thinking about right now that he was tested, I think, close to 2 weeks ago, still hasn't got his results back. And if the testing is going to be useful, the best thing about that testing is it tells you whether or not you're contagious or not. If you're past an incubation period or into that incubation period and you get tested and it comes back negative, I think that you're reasonably sure that you are not going to be infecting other people. Now, I know our recommendations are even if you get a negative test, you still have to quarantine through the 14 days. But there's people who've hit the end of the 14 days and have been tested during that time and still haven't got their test results back. So that's a bit frustrating. I would like to see us focus some significant energy into reducing the time to get the results back of these tests. For them to be useful, ideally we would be down. In fact, I understand there is a test out there that the results are nearly immediate. As I talked to someone who was tested at a Med Express in Andover, and he was able to get the results back from a nasopharyngeal test in 30 minutes. I don't know what the accuracy of that is. I've done some research on that. I know it's not as accurate as we would like, but if it's 95% accurate to 98.5% accurate, that's very, very encouraging. And I would think that would go a long ways to reducing the spread of Sedgwick County. I think that one of the challenges we have is people don't have the data to know how they should change their behavior.
So I agree. There is a test that we have in the city that's that fast. Trouble is, the vendor is not able to provide the kits. We got the machine, but the one entity in town that has them maybe gets 3 or 4 testing vials a week. And the company just says, we can't produce them fast enough. So there is a machine out there, and one of the entities in town has it, but they can't get enough vials to do the test. I can tell you, our hospitals are frustrated too. They can collect it, but they have people in the ED, they collect it, and then they have to wait 2 days to get it back. And what do we do with that patient in the meantime? And they have also expressed an interest of how we could get a machine in Wichita that can run these quicker and have results back at, even the next day would be better than what we're at. I will tell you the turnaround time depends on which vendor you use. Some of the private vendors in which we have to send the test out of Wichita to be done have had some problems with, we're told that their machine either broke down or their personnel were sick or something, and I've had some cases where it took 4 to 5 days to get it back. I think KDHE, which is what the health department's been using, has been pretty reliable recently in getting them back in 24 to 48 hours. But even that, I know our hospitals are a little frustrated that it's taking that long on patients they have here in the hospital. We got to make a decision. So I know there's discussions going on now about how much it would cost to get a machine here. They are expensive. Now, some of the other new tests out there, the antigen test, which would probably be easier and not as expensive to get, and we're investigating that. So I agree with your points.
All right, thank you. Back to the potential mask order that's coming. We've not seen that. Excuse me. We've not seen the details from the governor, exactly what's going to be, coupled with that in terms of rules and regulations. But I'm curious if someone has had COVID-19 and they've recovered in the past. My assumption is they have the antibodies at this point.
That's an assumption. That is one of the things we're trying to learn, is how effective is their immunity. And at this point, I've not seen any data that the medical community is comfortable saying that they are immune for the rest of their life.
Okay, I'll suspend my question on that. Then that's all right. Thank you, Mr. Chairman.
Okay.
Let me add one thing. Even with the mask issue, even if that governor's order sticks, I think all of us, if we agree with the masks are somewhat effective, we all need to figure out how we can encourage the community to do this, to wear them when they're out close encounters. Even an order is very difficult to enforce. And so the public has to have buy-in if it's going to be effective. How do we convince the public it's worth whatever effectiveness the mask have, even if it's low? It's fairly painless, at least in my opinion, and it's inexpensive. How can we all work together to convince the public, do this because it's the right thing to do? Even if the order is invalidated, it's the right thing to do. How can we all convince the public? Any other questions?
Yeah, Dr. Menz, just one more, and then hopefully we can move. There's a lot of information to digest as we've been discussing. I know that I had conversations last night, and I'm sure it'll be this morning, regarding masks. Private property, obviously, we talked about cars, but if a business, we could even go massive, like Spirit, on the masks. Or we want to trust that Spirit will do what they need to do. Some other privately owned businesses that don't really have retail or visitors, they just have their own office. Maybe they have a scheduled appointment here or there. Those are the questions we're going to get. Hey, I'm just an insurance. Mm-hmm. This is where me and my staff come, and are we going to ask them to mask up during their 8 to 5 job, so to speak? Do you have a feeling about that? Or
yes,
is that
I
something
do. Fine. They don't have patrons coming in. It's the same employees every day, but those employees are circulating out in the community, and how you know not one of them isn't coming in asymptomatic and spreading the virus? And how many of your employees do you want out now for a 14-day quarantine? That's not good for business. So again, I think we need to have that discussion, even if there is no order. This is one of the few ways we have to keep this thing from spreading so fast. It's not 100% effective. I don't even know it's 50% effective, but I know it's more than zero.
Right. Okay.
So we're trying to help your business keep going and not have interruptions.
That is true. We want the businesses to stay in business.
That's right.
Too many closings already. Okay. Well, Dr. Egg, I can't thank you enough on behalf of us. I think we're got a message, going to talk to Johnson County.
Right.
Ed Eilert called, the chair of Johnson County, so I don't know where they're at. If there's anything profound, I'll be glad to relay that to you.
Well, thank you for the opportunity to meet with you, and I just want to reiterate, I look forward to coming back in a year when I can talk about something other than COVID.
We look forward to it too.
I know we're all weary. I acknowledge that.
That's
We're
a-
all weary of this.
If that's a
Everybody's
motion, I'll second that, for sure. Okay. All right, doctor, thanks again. And thanks for all you're doing. Appreciate it. Okay,
Okay, Tim,
Tom.
testing.
Good morning, Commissioners. Tim Kaufman, Deputy County Manager. I'll give you a brief update on some of the testing work that has happened in the past week. Last week, the Health Department collected a total of 1,260 samples, 76% of those coming through our drive-through sampling site. 242 came from 2 different mobile outreach sites that we operated, and about 2/3 of those sampled were without symptoms, the asymptomatic folks. As we start this week, we have 12,020 sampling kits. Last week, we went through 1,260 kits, and we received 371. And so, again, sometimes we use more kits than we receive. We continue to order on a regular basis because we don't want to run out. And as we see testing increase, we want to make sure that we have a ready and available supply. We're about to wrap up our random sampling collection process this week. We reached about 25% of the individuals that we intended to, either directly or through a return call. About 20% of those folks agreed to be scheduled for an appointment, and about 65% of those folks showed up for that appointment. I would like to thank everyone that participated in any way in this project, even the folks who didn't respond or the folks who responded and then chose not to participate. Even with these limited results, we've learned a great deal through this process, and it will help us know how to do things in the future as well. So that's kind of where we're at with that random sample that we wanted to conduct. As I indicated last week, the majority of those that were tested were individuals without symptoms, and most of those were self-referrals through 211. Interest by individuals without symptoms continued to grow throughout the week, maybe because of the modeling that you folks did as you went through that sampling process yourself. Thank you for doing that. But we got to the point where on Friday we had over 1,000 calls that we need to return, and that was just more than our system was able to handle. And so we did make the decision on Friday afternoon to suspend our scheduling for asymptomatic folks who aren't part of that special, they don't have a specialty designation in that they work in healthcare or they're first responders or they're close contacts of someone who's been identified as a positive. So we will continue to get those folks scheduled and tested this week, and then going forward, we're going to test folks that don't have symptoms if they meet one of those other criteria. But as the volume of testing has increased over the past number of weeks, all of the associated processes that go along with that have increased as well. So the number of calls that we do to get folks scheduled, the number of calls that we need to make to inform folks of their results, they've all increased, and so that has led to a little bit of a slowdown in the process that it takes to get that information back to individuals. The other thing that we've seen, and Dr. Mins referenced it a little bit as well, some of the labs that we've used are being stressed, not only nationally but locally. There have been increases in testing volume across the country, and there's just a limited number of labs to be able to do that. If everything times out perfectly, we should have positive results. We should have notified individuals of positive results within 3 to 4 business days, and folks with negative results should be notified within 5 to 7 working days. But sometimes that test volume can impact the ability of a lab to get results back to us, or KDHE may struggle to get that information entered, and then as we pull that information out to use that to notify people, it may take us a little bit longer. And so we know that we need to automate some processes both on the back end and on the front end regarding scheduling, and on the back end regarding some of the ways that we handle the data that comes back and then get that data distributed. So we're looking at different options from a technology standpoint that can help get this process going. One of the issues that we have that limits the amount of sampling that we can do is staffing. And so, as you know, we requested a number of additional positions. We've had those posted for a number of weeks. We continue to struggle to hire folks who have medical expertise. I think we've filled most of the positions that don't require any medical expertise or skill, but we continue to struggle to find folks who are medical providers. We're actively recruiting them, and we fill some every week, but we haven't filled all of them yet. We continue to look at lab additions and alternatives. We're looking at whether or not it makes sense to add additional labs. Each lab that we contract with has a little bit of a different process, and so we have to figure out, is the additional overhead as we sort through multiple labs worth the return time? Because sometimes we don't pick up any speed on the back end as we add overhead on the front end. The other thing that we're looking at is different sampling methods and at lab equipment to see if there's an opportunity to add some additional equipment to our lab at the health department so that we could process some of the samples that we take locally. We're in a process of investigating a couple of different machines that would help us do that. And then we're also looking at some different testing processes as well to see if we can't speed the whole process up. We have 2 mobile testing sites going this week in Colwich and Goddard. And again, I would mention that we are testing folks that don't have symptoms if they meet some of those extra criteria, if they're first responders, healthcare workers, or work in a congregate setting. And once we resolve some of the volume issues that we've faced, including some additional staffing, our intent is to resume scheduling for asymptomatic individuals that don't meet those specialty criteria. I'd be happy to answer any questions you may have.
Okay, are there any questions from the commission? Commissioner Cruz.
Thank you. I'm just curious to see where we're at with the other testing, like so the CytoCheck laboratory. My main thing is keeping our tests, and if we have labs here in Kansas, using our Kansas labs. I mean, we're sending stuff to California. Can we use Kansas labs to see results? And that's my biggest concern and my question, and I'd love to know where we're at with that.
I know that we've made contact with the CytoCheck lab in Labette County, and we're talking to them about whether or not if they can handle the volume that we would need. So we're in discussions with that lab as well. As Dr. Mins mentioned, the Cahill lab, the KDHE lab, we have faster turnaround with that lab. They have some restrictions on the type of samples that we can send to them. So it would be ideal if we could either add additional capacity here in our health department lab, or if we could identify another local lab within the state that we could use. So we continue to pursue that opportunity.
Thank you.
Okay, Tim, I do not see any other. Thanks
Okay.
for the information. And
Chairman, real quick, just to add, Lindsay will be up tomorrow. We'll talk about CARES updates tomorrow during the official meeting, but we've had robust discussion about the testing side of things and CARES funding. And Lindsay will go over this again tomorrow, but it seems fairly clear in the CARES world, under the current rules, that you can either pay to acquire testing from another lab, or you can pay using CARES money to bolster your own lab. For example, as Tim brought up, to bolster our own health department lab. It's pretty straightforward that we can't pay for research and development. We can't pay for standing up a lab outside of our own entity. So we're beginning to get some more information on the CARES dollar side of that, and I'll have Lindsay cover that again with you tomorrow. But that's one other thing. There's a number of, in addition to Labette, Ascension, Heartland Research, WSU, there's a lot of things pouring in with the next generation of testing, to the point where I want to talk with Dr. Menz about standing up a research group, a group of professional doctors or medical staff that can look at these proposals and give us good guidance on what to recommend to you all as we move forward on this. And we'll have to do this in fairly short order. So it just seems a little bit, as this thing evolves, it seems almost a little bit overwhelming for staff, not just to keep our current day-to-day operations up, but also to look at the next generation and cycle of what we're going to have to move towards. So we'll be seeking some outside input on that. I just thought I'd give you the update on that as well. So,
Okay.
and I think, Chairman, also Rusty wanted just a minute to talk about some PPE stuff that's going on in the community that I think is germane. So, Rusty, you want to get it?
Morning, Rusty.
Morning. Rusty Leeds, Public Safety Manager. So I wanted to bring to your attention, Kansas Department of Emergency Management had given notice fairly recently that through their efforts to acquire protective equipment, they have compiled a great deal of non-medical protective equipment that they need to, or that they want to move out of their warehouses. So to that end, they have made available to certain businesses this non-medical equipment, and they're requesting that the businesses apply for a 90-day supply. It'll be a one-time. Right now it's intended to be a one-time offer and a one-time supply delivery. So to that end, today we have online on the main page of our webpage the business, I can't read it from here, but it's the business, non-medical business PPE request form. So we have a link, communications. Kate will put out some information later this morning. I did talk to Keith Lawling yesterday, and he has indicated that he will help once we receive the orders, we place the order with the state, and we determine how much material we're going to get in. He will help with volunteers to help us get that sorted in a timely manner and get it distributed and liquidated in a very timely manner. We don't have the space and capacity to bring this stuff in and house it. So whatever volume we get from the orders that we receive, we want to move that stuff out in quick order and get it off our books. So the businesses that were made eligible for this are faith-based organizations, food supply, including restaurants and grocery stores, dentist offices, utility businesses, and there was a other essential infrastructure, manufacturing, and distribution businesses. That kind of relates back to a executive order that the governor put forth back in March that outlined the Kansas Essential Functions framework. And so it includes a lot of businesses, and we're not going to get real nitpicky on this. But the form is up. It's pretty straightforward. They go in and fill in the necessary information, tell us what they believe they need for 90 days. At the end of the week, we're going to do this for 7 days. 8 o'clock next Tuesday morning will be the cutoff. We hope by Tuesday afternoon we have all the numbers compiled and we get an order into the state, and then we'll see what we get back from them to help our local businesses out in this capacity. The items that they have available are non-medical KN95 masks. While they're labeled as N95s, they are not medical grade. They are adequate for employees in those types of businesses or for visitors coming in that need masks. Face shields, 3-ply masks, level 1 cloth reusable washable gowns, one-time use impermeable gowns, and then some other cloth masks that are non-medical. So it's a limited field of materials that are available, but these are all non-medical. We can't give them to first responders or medical providers, so they're being made available to the businesses. So I wanted you to be aware of that. We have it available on the website. We'll advertise it, and we'll see what kind of response we get.
That's good news. So Rusty, so on that form that it was pulled up, so is there a list of what's available? You just said the six or
There
seven.
is.
So it's in there, so they can drop down.
Right here on this
whatever.
page, yeah, it'll show,
Okay, there you go.
it has each one listed, and they can
Okay.
put in the number that they need.
Okay, that's very good.
Yeah.
Thank you for that information.
Can we get the thumbnail that's, so if I was going to share this, it's not just some crazy account login information. We need to get that changed so that we can actually advertise this properly. Okay, thank you. Got to do some shares, let people know what it is. They only have 7 days to request.
They do.
So,
And we were rushing this morning. IT has been an excellent partner, and they were rushing this morning to get this finalized, so we at least had it up on the site. And we'll clean it up, but we'll get it advertised and give them a chance to get their orders in.
thanks.
That's all I have for you this morning.
Thanks, Rusty.
Thanks.
Good
We have a
information.
COVID task force meeting this afternoon. I'll be sure to mention it in that venue as well. And Keith's also on that task force, so.
Okay,
Ready to shift gears, Chairman?
I'm sorry.
Ready to shift gears?
Sure.
Very good. Andrew, why don't you,
Good morning, Commissioners and Chairman. Andrew Diltz, Director of Facilities and Project Services, to present Direct Renewable Participation Service Agreement, also known as the DRPS tariff. A little bit of the background. Beginning in 2019, the Facilities Department began evaluating renewable energy sources and suitable facilities. I came and presented to you in December of 2019 an evaluation of installing solar panels out of the Extension Office, and the result of that was to allocate some funds, and I need to make a correction here. I believe the $225,486 is funds that was set aside for making improvements to the facilities, not necessarily conducting the energy audits. I'll get clarity on that from Lindsay, and I'll be back to update you guys on the results of the RFI that was published earlier this year here in the next couple weeks. The other option was wind generation, which led us to the DRPS proposal with Evergy. What is the DRPS tariff? Developers work with Evergy and the Kansas Cooperation Commission, KCC, to erect wind turbines that provide clean, renewable energy. After the plant is commissioned, the energy produced from this development is sold to participating members as renewable energy. The retail energy cost adjustment, also known as RECA, surcharge is substituted with a fixed charge per kilowatt hour, identifying a fiscal savings. Financial analysis of this agreement is there is no upfront cost or out-of-pocket cost to participate in the service agreement for the 20-year duration. The Ponderosa Wind Farm is located in Beaver County, Oklahoma. It becomes operational at the end of 2020, immediately benefiting the county in January or February of 2021. In the last 5 years, Sedgwick County spent an average of $2,530,000 on electricity annually. Of that total, $582,540 is attributed to fuel charges, or the RECA charge. The substitute charge for fuel is 15% lower than the average fuel charge the county has been paying. The 5-year average fuel charge has been 2.1 cents per kilowatt hour, and the long-term service agreement locks in the fuel charge at no more than 1.8 cents per kilowatt hour for 20 years. The purchase increments are available in 1 megawatt increments. In 2019, total consumption was 6.3 megawatts for the county. We recommend purchasing 5 megawatts, which is approximately 79% of our total consumption. Sourcing 79% of the county's energy from wind would result in an annual savings of $60,000 to $79,000. Transitioning to 79% wind power would diversify the county's energy portfolio and allow for further energy reductions without penalty. By entering this agreement, all Evergy bills would be utilizing almost 80% clean, renewable energy to power our facilities and our parks. An option is available to allocate the renewable energy to specific accounts, allowing a building or park to function on 100% clean, renewable energy. The DRPS agreement will be presented at the BOCC meeting next Wednesday, July 8th. And I'm available for any questions, and I believe Evergy is on the line as well to answer any questions that I cannot.
Are there any questions from, thanks for the research and the presentation. Commissioner Cruz has a question.
I don't really have a question, just more of a statement. You know, when we talked about this last year, it seems like ages ago now, but there are so many options available to us. And so when we talked to Evergy about this agreement a while back, it really wasn't really ready yet. And so now I'm very delighted to see that the potential savings, the clean energy that will allow us to power our buildings and our parks. So I just appreciate the work that you did. I know this was not an easy thing, but I'm excited about the possibility to switch over to a clean energy source. So thank you for your work.
Okay. I don't see any other comments, so appreciate it.
Okay. Thank you.
That's all we had, Chairman.
Okay. All right, Tom, thank you. Is there any other comments? Thank you for all the information this morning, and we will see you. Oh, Commissioner Howell.
Thank you. Mr. Chairman, I just wanted to say, since we don't have the governor's details on her executive order until, I guess, Thursday at some point, should we go ahead and tentatively schedule a special meeting for us to discuss that as a commission sometime after that data is available?
Okay, and I thought, my thought was I was trying to get with the business community to have the input from them as well, because they don't know what it's going to be. Nobody knows what the details are going to be yet.
I understand that, but since we know this executive order begins this Friday at 12:01 a.m., if we want to review that and make any changes in accordance with the House Bill 2016 that was passed and adopted on June the 8th, we have to at some point meet and discuss that. And I don't know, from a legal perspective, if that is something we can even speak to until we know what the details from the state are.
Commissioners, Mike Papoon, County Councilor. I thought I was going to get the whole meeting without having to say anything, but Commissioner Howell, there's nothing in the legislation that gives a time limit or restriction as to when you would be reviewing that order, and certainly without that order, there's nothing to amend or
well, that's the challenge. So my problem is we don't know what the details are. For example, let's say we wanted to take Dr. Min's recommendation for travel restrictions.
Right.
Maybe we need to, because the governor's only talking about masks, and I think that just with the issue with masks, there's a lot of questions about how that applies to Sedgwick County. And maybe she'll provide the details there, but I have no doubt we're going to have a lot of opinion from the community, and I think commissioners need to speak to that. So I think we ought to just plan an opportunity for commissioners to process through what's being given to us on Thursday. And we potentially might need to make some tweaks to what she's talking about here in Sedgwick County. I don't know that we ought to necessarily adopt it as is. Maybe that's the right position, but maybe it's not. But I think we ought to plan an opportunity for us to get together and discuss that in a public open meeting. And if we want to make changes, that's our chance to do so.
Well, We're closed Friday, right? It's a holiday. Friday's the holiday.
The courthouse will be closed on Friday.
Courthouse
so-
closed on Friday. So I think it's a little bit dangerous if we get information from the governor in the morning hours. We don't know that for sure. And if we have a business meeting, getting feedback in real time from the business, and then to adjourn from that and go right into the commission will have basically a few hours to digest all the information coming at them. I'm not excited about meeting right away to endorse, correct, or anything like that at this point. We can talk about it further and see. Today's just Tuesday. If we want to meet on Friday in a special meeting when everything's closed, I guess we could try to do that, or we can watch it and meet Monday. So.
It'd be my suggestion we would meet sometime Thursday afternoon and just tentatively schedule that. We could always cancel it, but at least if we knew to plan for that, would give us a chance to know.
Well, we don't have the business meeting quite confirmed yet, so, but Commissioner O'Donnell?
Thank you, Mr. Chair. If we do have a meeting on Thursday, I think it would be imperative that we have the sheriff in the meeting as well, because that needs to be discussed. What the enforcement will be. It'd be great if we could have Chief Ramsey or representative from the police department too, and maybe even District Attorney Mark Bennett, because we need to figure out if the governor's going to be having people arrested, if they, don't comply with the order, or how we're going to handle citations, if that's going to be done by municipalities, or if the county is going to have to enforce that, or if we're going to do it with the cities. So I think when we're talking about this meeting, we need to make sure that it's comprehensive. So, thank you, Mr. Chair.
Okay.
I think the one thing that we probably should not do is jump to conclusions. We don't have what the orders says. We don't know that there are going to be arrests. I think jumping to that, who knows, maybe she'll just say, hand out a mask. I think that we need to, since this topic is so very charged, and at the end of the day, it's about making sure that people feel safe, making sure people don't get sick, and that's really where we're at. So I would love to hear from the business community before we make any sort of decision, because here locally, they're really the ones who are driving this bus, and we need to make sure that they feel confident. Our small businesses especially, it's so imperative that we support them. We make sure that we want to keep them open for business, and that's why I think rushing into a decision like this without hearing from the business community, I think that would be the best course of action in my opinion.
Commissioner Howell?
Thank you, Mr. Chairman. So I'm just curious, since apparently two commissioners are calling for that business community meeting, can you please tell me when that's scheduled to happen right now?
We don't have it set yet. I wanted to confirm with the governor's office. Hopefully we'll get information that morning, but I don't know if she's not going to release information until the afternoon. I want the business community, my desire would be the business community gets a chance to hear what that is and then go from there.
Whether we have information from the governor's office or not, I think we ought to tentatively schedule this business community meeting to happen.
I was hoping at about 1 o'clock is what I was hoping for.
I think that's a great idea.
But if the governor doesn't release information till 2 o'clock, then it's not going to be 1 o'clock.
Well,
I can only say what I know.
yeah, I understand that. And I just think that even if that was the case, there's still value in that community coming together to talk about what we do know. And what we do know right now is that there is a mandatory mask order coming for public places that'll be starting the following day, on Friday. And I think that that's enough information for us to hear from businesses and how this might impact them, and clarity, that the things they would need to implement that order as best we understand it at that time. So I think there's value a meeting on Thursday at 1 o'clock if that's the time that you guys have determined, and then after that for the commissioners to get together and whatever information we have available to us at that time, we can certainly process through. But I just have so many questions about application and implementation of what we do know right now. And I just think that we ought to understand that we absolutely are going to have an opportunity for commissioners to get together sometime between now and Friday at 12:01 a.m. I just think we have to do that, even if it's Thursday evening. If it's Thursday night at 7 o'clock p.m., that's fine. But we need to get together and have that discussion. And so I would like to ask that we would make some tentative plans. If we need to adjust those plans, that's fine.
Okay, I'd like to visit with each of the commissioners, see what would work for their schedule. I know, I hear you loudly what your desire is, Commissioner Howell.
Okay.
So. Okay. Anything else?
No, sir.
Okay. Being none, then we will adjourn and see everybody tomorrow at 9 o'clock. Thank you.